You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get today's conversation started.
Hi, I'm Ivan Zach. Very excited to introduce our guest today, Sajna Massey. Sajna, I'm butchering your name. I'm sure that is
No, you're doing great. You're doing great.
Okay, there we go. Made an exciting transition to the artificial intelligence industry late last year, and is thrilled to be a part of the Sylvester AI, which is improving the cat health outcomes. She's focused on educating veterinarians and pet owners about the benefits of AI and how it empowers us to make more informed decisions. Sajna, welcome to the show. Thank you for finding the time.
Thank you. Thank you for having me. I'm excited to be here.
So we started the conversation today with talking about artificial intelligence, and when you're talking to veterinarians, Shawn, you should be careful because AI could be artificial insemination. So just be careful. But we're talking about artificial intelligence here and how it can help the pet owners and the veterinarians to understand their cats better. I rarely understand cats. This is the species that I struggled with working as a veterinarian. They always bite me. so I'm thrilled to learn. So tell us more about what is this project is about and how does it work?
Yeah, for sure. It's funny that you mentioned the artificial insemination comment because I set up a AI webinar with a university,
Oh
and
no.
it's all about artificial insemination. So I've been there. So Sylvester AI is an artificial intelligence company that was created to advance animal health outcomes. We've seen a lot of amazing advancements in AI when it comes to human health, but the reality is those same advancements haven't really been translated to animal health. And so that's really why the company was created. And so the reason we've chosen to focus on cats at the onset is just as you said, cats tend to be really misunderstood. They tend to be great at hiding their pain. They're kind of masters at masking their emotions. And of course, that's a huge struggle for cat owners, but even vets have a really hard time, as you mentioned, kind of being able to decipher some of those emotions. And so that's why we wanted to focus on cats first. We talk to tons of vets, and they usually say, we see 20 to 30% cats in the clinic. And we know based off of population data that that's not the ratio of cats to dogs in households. So we know that cats are kind of that underserved segment of the pet market.
Very interesting. So I want to know how this. Well, I want to first find out how did you decide, or how did Sylvester decide to explore this particular area? It's just not something that I've seen done before, so it's very interesting.
Yeah, there's an organization called Cat Healthy, which is a non-for-profit that's been around for well over 10 years, that had approached a contact at a artificial intelligence company saying, I wonder what we could do with AI to help cats. And that's really how all of these kind of cool projects get started, right? Is just, two people cross paths and they're like, hey, I wonder if we could do something in this space. And so we started kind of researching, the cat world in general, and a lot of information came up about the lack of proactive care with cats. Vets tell us, like, we see cats twice in a lifetime, when they're a kitten and near the end of life. And people do not care about, bringing in their cats every year or two for a wellness examination in the same way as dogs. And so that's really how the conversation of the project started. We came across a medical study called the Feline Grimace scale. And so that what the Feline Grimace scale is it's essentially a pain scale that can actually take into account 5 really, really subtle facial cues of a cat, like ear position, eye position, muzzle position. There's 5 factors that can actually indicate if a cat is in pain. So, in the same way a human might like scrunch their face, hunch their body over, usually we'd be, verbally screaming or something if we were in pain. It turns out that there's some very, very subtle cues in cats' faces that actually can indicate they're in pain. So we came across this and thought to ourselves, could we automate this reading through artificial intelligence? And it turns out we can. So we've developed a product that can detect cat well-being simply through a photo by rating the photo on the Feline Grimace scale.
It's absolutely incredible. Very, very neat stuff. So I definitely want a little bit more detail on the origin story. Who's behind this company and kind of where you guys going next? It's a really interesting product, and I'd love to learn a little more.
Yeah, so sylvester.ai is a joint venture between an AI company and then one of the founders of Cat Healthy has a company. And so we joined those two companies together to create Sylvester.ai. In terms of where we're going next, I mean, the really cool thing about AI is that it only gets better and better the more that you use it and the more data that it feeds into. So today, our tool is primarily being used as a remote patient monitoring tool. So, say you have a cat come in for a dental surgery, and you can actually prescribe Tably to that cat owner and say, okay, for the next 2 weeks, I want you to use the app to monitor the cat's recovery. And maybe by day 3 or 4, if our program is telling the owner, oh, the cat's not really recovering very well, it's consistently showing as unhappy on this scale, then they know to prioritize going back to the vet. Because we know a lot of dental surgery follow-ups can happen 7 days after, 14 days after, and if that cat's struggling on day 4, it can be seen sooner. So that's kind of the primary use right now. I mean, in the future, we wonder if, as we continue to collect more data, are there facial cues that can indicate certain conditions? As an example, is there a certain muzzle position that can be an early indicator of dental disease? Is there a certain ear position that can be an early indicator of ear mites? Something like that. So that's not something that we've incorporated today. But I mean, it's definitely a hypothesis that we have that maybe years down the road that could be likely.
Great. And so what's your business model? How do you guys get paid? How do you make money?
Yeah, so we charge the veterinarians it's a subscription model per month. So they pay a set fee per month, and then they're able to give out as many subscriptions as they'd like to the cat owners.
Great. And what's the feedback been so far?
The feedback has been really, really incredible, especially with COVID. People don't really want to come back into the clinic in the same way that vets don't want a lot of foot traffic in the clinic, right? Everything's been curbside pickup. Like one of our first use cases when we were actually testing our prototype was a cat that had come in for dental surgery, and the vet was really, really worried when the cat left because they had to extract almost every single tooth because they were rotting so badly. And the vet was saying, if that cat goes home and rips out its sutures, the risk of rot could be entirely catastrophic, to the point where it could have some really fatal outcomes. And so the vet was bringing in the cat every 2 days for a free 10-minute check-in to make sure it was recovering okay, which is, on one hand, inconvenient for the cat owner, on the other hand, inconvenient for the vet. On the other hand, we all know cats hate going to the vet. And so to be able to eliminate that workflow by having that remote model is super, super convenient for all parties.
So that is very interesting. So you almost like jump 2 steps ahead of veterinarians. They're barely able to adopt the telemedicine these days, and now you're automated telemedicine. That's incredible. What would that report looks like when the owner is looking at the cat or the scale? Is it like happy, unhappy, or painful, sad? I want tuna. Like what are the interpretations that the technology gives you?
Yeah, so today we have like a binary scale, which it's like just 0 or 1, and we say like well or unwell. The Feline Grimace scale is a pain scale, but the reality is that a cat could grimace if it was on the kitchen counter and I told my cat to get off, right? I might have upset it and it's going to grimace at me. And so the way the system works is we get the cat owners to take a series of pictures throughout the day so that that you're capturing overall well-being rather than mood at a certain moment. And then we also incorporate a series of health questions into those 3-a-day check-ins. So the vet, when they're prescribing Tably to the cat owner, they can actually choose what questions they want the cat owner to answer every couple hours. So are they eating? Are they being interactive? Are they sleeping? Things like that. So that they can get that overall health picture, right? Because yes, the grimace scale is great, and being able to detect well-being from a photo is great, but to be able to kind of have those extra pieces of information can be really, really critical.
On this platform, I mean, I love the message, and I think that this will resonate with a lot of veterinarians, because you're right. There's definitely not 30% of cats and 70% of dogs out there. And yes, cats don't like going to the hospital. So it would be very neat for your sort of going forward metrics to see if at the level of the hospital you could increase interactions with the cat owners remotely rather than bringing them to the hospital, because it solves two things.
Mm-hmm.
One, it solves the regular interaction with the veterinarian, and if there's a concern that could be brought in earlier. And two, it creates scalability of the services, because you don't have to bring the pet to the hospital, and that's what veterinary medicine is struggling with right now, because there's 45% of clinics are looking for 1.8 vet. So basically, there's 45% clinics that could use almost 2 vets.
Mm-hmm.
So scaling any processes like this would be wonderful. So I'm wondering what's the sort of demographics of the vets, because there's people that like to work in cats only hospitals. God bless them, because I would somehow me and cats don't do well together. And but is it more sort of a cat oriented veterinarians, or is it you have the all kinds of veterinarians interested in this?
Yeah, I mean, I think we do probably see more of the cat-friendly practices and more of the fear-free practices. I would say that is a majority of the users on our app right now. We do definitely have a lot of mixed animal practices. I think more than anything, it's about the technological readiness of a clinic. Like if I see paper, I'm scared. If I see a manila folder, I'm running for the hills. It's interesting because, like you mentioned, right? So many clinics are understaffed. I've read so many different articles about vet burnout and some really jarring articles about suicide rates in the vet industry. And I think it's tough because you have to make room and time to adopt new practices and adopt new technology. And of course, there's a learning period, but depending on the system, maybe a month out or maybe a few months out, you realize that you are saving tons of time. And so I think you kind of have to, bite the bullet in the beginning to understand that there's some long-term benefits in, whether it be saving time, saving money, making more money. There's really tons of different ways that technology and AI specifically can benefit a clinic.
Yeah, we've had lots of really kind of spirited conversations around artificial intelligence and what it means for the vet space. And, me and Ivan both being in technology for a long part of our careers, I think it's really exciting and really like innovating, and it could be the thing that unlocks kind of happiness in the profession. So I'm all for it, and I think Ivan is as well. But take a run at explaining artificial intelligence for all of our listeners out there that maybe think that when they unlock artificial intelligence, the robots are just going to come get us and it's all going to be over. Maybe give us your take on that.
Yeah, it's something that I hear all the time. I mean, people do get a bit apprehensive about AI. And like what AI really is it's this umbrella term for some sort of system that replicates human intelligence. And so I always like to remind people, think about your day and think about, the 3 least favorite things that you did that day, right? Like one thing that I know I hate doing is taking meeting notes, because then I have to take those meeting notes and I'm scrambling to write them down as I'm having my meeting. Then I have to put them in my CRM at the end of the day. If there was a program to automate that for me, what could I do with that time? I could probably meet with more people. I could help my team on more meaningful activities. And so the way I like to explain it to vets is, imagine if you spent less time doing paperwork. Imagine if you spent less time, on the phones, or, we've talked to clinics who say they spend up to 8 hours a week just making follow-up phone calls from appointments. Well, now you have this app that can do it for you for cats. And so you have to look at it of a lens of, what could AI automate for me that I don't like doing, because there is at least one thing in everyone's day that they're not enjoying, right? And how can I, one, get back down to a 40-hour work week, which I don't think any vet has right now, and then two, be able to actually do the tasks that made you want to be a vet and kind of fall in love with your job all over again.
Yeah, no, it totally makes sense. And I think that that was a great explanation of it. What about dogs? What about other species? Like, have you guys thought about including them and kind of what's that future roadmap look like?
Yeah, there are Grimace scales for a number of different species. There's a Grimace scale for rats. There's a Grimace scale for horses. I think there's something quite similar for cattle. The tough thing with dogs is there is so much variance in the breed. With cats, like of course there are different breeds, but they tend to have a similar facial structure outside of maybe like Persians and Scottish folds who have some modified features. With dogs today, there isn't a Grimace scale, but I think if we had the data, like that's really all we need to build these models. So if anyone's listening, anyone out there at a university that wants to create a Grimace scale for dogs, we'd love to see it.
That's awesome.
I can see an interesting business model here, not only from the sort of actual interpretation, but what you just said is quite important. Is that it increases the interactions with the pet owner, and also it creates additional notes that they can take it home. But it almost creates this sort of, I don't want to call it's almost like a gamified approach. You really kind of take participation and sort of clinical science taking rather than just recording things, and it sort of adds this fun factor to it. Is it all app to app interaction back to the veterinarian, or are you kind of looking into integrating it with some existing software products?
I think ideally, definitely our long-term plan is to integrate it into some of the larger like practice management softwares because we know no app or no vet needs another app, right? I talked to a vet yesterday who said she has 5 apps. She has their scheduling app, she has 2 telemedicine apps, their own app, and we know there's tons of apps out there. So I think integrating is something that's super important because we want it to integrate seamlessly into a workflow.
Excellent. So we're nearing to the end here, and we always end with similar 2 questions. And it will be interesting to hear what sort of a book or TED Talk or YouTube video that inspired you recently, and if you want to share that with our listeners.
But there was a book I recently read that was called Working Backwards, and it's written by 2 previous executives of Amazon. And I found it really inspiring because Amazon is this huge behemoth, and they distilled some really core practices of Amazon very well into this book. And I think there are things in that book that are applicable to any business, whether it's a business like ours, an artificial intelligence company, whether it's a clinic that has 1 vet, whether it's a 24-hour hospital that has 10 vets on staff. There was a lot of really interesting leadership, operational, product principles that I really liked in that book.
That's awesome, Sajna. It's been a pleasure to have you on. The last question we like to ask is another innovator in the pet space or the vet space that you think we should have on the show.
One person that I really enjoyed talking to recently was Dr. Wendy Hauser. She's a veterinarian consultant. I also love the team over at Basepaws. I think they're super fascinating, doing really incredible stuff in the cat space. I know Kristen that works on their BD team would be a great guest as well.
Thank you so much for listening to the Veterinary Innovation Podcast. We want to invite you to join the Digital Veterinary Summit, which will take place virtually on 27th, 28th of July. The event brings together over 150 executives from the veterinary industry to examine the sector's digital trends and dynamics and showcase the industry's most exciting emerging technologies.
If you are a digital veterinary innovator, you can apply for the Digital Technology Showcase and get a chance to introduce your product to the audience. My friend Ivan is on the selection committee. Please go check it out at thedigitalveterinarysummit.com.
If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryin.to. See you next week.